Today, we're going to be talking about how technology accelerates innovation and digital transformation. History shows us that crisis often inspires innovation, and in times of crisis, information can save lives. Joining me for this discussion is Clay Townsend from Parkland Health and Hospital. Welcome, Clay, and thank you for joining me.
Hi, Sally. Thank you. So my name is Clay Townsend. I am the Director of Enterprise Data Services here at Parkland Health and Hospital System. Just a little about myself. I got into data back in 2009, doing a lot of financial and logistical cost modeling. Kind of led me down the path of trying to solve problems with data and realizing there was quite a few problems there. And then in 2014, I took on a role with Parkland as a data architect. 2014 was an interesting time at Parkland. We were still really focused on report writing. And so there was an opportunity there to advance our architecture, our technology solutions to be more data focused. And throughout the next 4 years at Parkland, that was really my mission. Then in early 2019, I took on the role of director here at Parkland.
So Dallas is the 9th most populated city in the US. Tell us about Parkland Health and Hospital System and how you meet the needs of this large, diverse community.
So a little bit about Parkland. It's been around for over 125 years now. In 2015, we took on the new hospital, Parkland 3.0, the third iteration. And it was one of the most connected hospitals in America at the time. And it's more than just a very beautiful building, but it acts as the main county hospital for Dallas. And then it's further supported by roughly 20 clinics. Now, when you look at the Parkland Hospital as a whole, it's a fairly large site. It's 3 million square feet. There's one existing large outpatient clinic on site with another one going in. And it's about 900 rooms in total. The ED itself is a little over 100,000 square feet. Now, Parkland's more than its building, like I mentioned before. Our goal as a county hospital is to foster community partnership, focus on population health initiatives, ways to improve the community, and really focus on the outcomes and drive value for the people of Dallas County. And we do all that while at the same time, in 2019, we were the busiest ED in America with a little over 240,000 visits. Now, as you walk through Parkland, there's more to it than the community itself, but the population we're serving. So just looking at the payer mix for Parkland, we're driven primarily by Medicare, Medicaid, and charity, with only a little bit under 8% being commercial insurance. And just some stats up there, I mean, we saw over 1 million outpatient visits at Parkland. And like I said, already #1 for emergency room visits, unfortunately at a little over 240,000. So our team, Enterprise Data Services, within IT at Parkland, our approach is to put analytics first. And we do that by being an extended member of the care team. So when you look back at when we first started as a group at Parkland, our goal was to write reports. And that's not any longer the case. Our goal now is to enable the business to get the analytics they need. And we do that by supporting the infrastructure, by training through data literacy initiatives, and reducing bottlenecks that prevent people that need the data to make decisions from getting to their data. And really that gets back to embedding our analytics resources again into the business.
I love that mindset of the technology department being an extension of the healthcare team. So let's start with an overview of the Parkland architecture. What does the landscape look like that keeps a hospital the size of Parkland running?
So our analytics infrastructure starts with the EMR. In this case, it's Epic. And in this avenue, it's much like the traditional reporting environment. We have a transactional system. We have a downstream reporting database in Oracle that's relational in nature. And then we have a data warehouse over in Caboodle that is also made available. But when you look at all the data at Parkland, there's a lot more than just Epic. There's over 200 other applications that are providing data to the organization. And those can be rather large applications, things that our HR makes use of, PeopleSoft, SuccessFactors, our financial systems, our supply chain systems that are up in the cloud, our ticketing system, ServiceNow, to smaller systems, the badge readers, systems that look at the images from radiology output, and then the devices themselves. Vital monitors are constantly streaming data, telemetry machines, infant warmers, those are all producing data that we want to capture. And so when you have this large collection of applications and data, you have to have a place to start collating it. And in this case, we make use of SAP HANA for that. So our SAP HANA environment, we either replicate data, batch load data through ETL, or stream data from these systems or virtualize it to make it available inside of our logical data warehouse. And that's really the EDS role in this capacity, is to support this infrastructure. And then we go out and we train our distributed groups so that they can make use of it. They can produce models on top of the data. Now, another component of this is really the SAP XSA component, making use of Web IDE, which is something we've more recently moved to. And in our case, we're doing it in a hybrid type environment where we're keeping most of our enterprise data on premise, but we're supporting the development components up in the cloud. And so this allows us to divorce the data from the development, and all these components that are in XSA that require administrative burden are actually supported in the cloud environment. It also means that our distributed groups, if they have niche pockets of data that they want to make available to the enterprise, they can do that through the cloud HDI containers. And we've made heavy use of that to our benefit. Now, after these models are built and made available inside of our enterprise data stores, it's about presenting it forward, right? And so in this case, we use SAP Analytics Cloud and their digital boardroom product. We use traditional on-premise business objects, so your classical BI through Web Intelligence and Crystal reports, but then our data scientists as well. They'll log in and they can make use of all these models to produce data assets using the PAL library or the APL library inside of HANA, or even R and Python. Those are all things that are available to them. And all these components we push out to the consumer base for them to either go and retrieve through self-service where applicable, or to push out to them.
So 2020 has been a year that none of us imagined. Its challenges highlight the importance of innovation. The COVID pandemic has thrown many organizations into uncharted territory, straining IT and business resources like never before, and it's led to unprecedented demands on healthcare providers. Parkland has been thrown at the forefront of the battle with COVID, and overnight you needed real-time access to data and insights. So how has the use of technology and the need for this real-time data changed things?
So when COVID first came about, we recognized that there was a real need to do this differently. Things were moving very quickly. From an operational standpoint, the hospital went into disaster mode, meaning that we had a command center. Leadership at the hospital was meeting twice a day, and they were trying to make decisions as quickly as possible. And so rather than go about this in the traditional manner of providing reports or tabulated data, we set about making an operational dashboard, the COVID Command Center dashboard. And the first step that we took when we went about this was to grab the clinical and operational metrics. So things like how many patients are currently in the hospital, where are they located? But that expanded in need. And really what we had to do was start supporting it with real-time data. That was newer for us and not something that we traditionally had to do. And what this evolved into was a one-stop shop for all COVID-related metrics at Parkland. So you could take a look at all the clinical components, what's going on from an isolations, what's going on with laboratory data, lab tests, how many patients are being seen, what's the trend over time, what do we think the doubling rate is right now, what do we predict out will happen in the next 7 days, to more operational components. So how many people did we see at our community testing sites? This being data that we don't traditionally capture inside of our EMR system. Also things like our call center, something I would have never thought of was the need to take a look at the amount of time it would take for a call center individual to answer the line when a person in the community was reaching out. And so we used all these metrics to help support staffing in that capacity and to drive down those wait times so that we could get people out there for testing and everything else. And this also evolved itself because as you move away from just the clinical and operational metrics, you start getting into the components of our teams of physicians that are caring for the patients who are also being overburdened. So we had a need to take a look at all the various care teams, what their capacity was, and then start ranking them, green, yellow, red, how can we move patients around? How can we move staff around? And then as you move down the line even further, you can take all of these components and start kind of giving the organization a ranking of how we're doing. If we're in a red or a yellow or a green state, this is going to alter the velocity of the command center and the decisions they have to make, and likewise drive the decisions. And these are all the components that when you look at the COVID response are really analytics driven. And that's not even touching on some of the predictive. We took a look at patients that we may need to reach out to because of proximity to a positive tested patient, and using that as a driver to get social determinant information. Do they have food insecurity? And all these together help form our COVID response.
So today, the healthcare industry is predominantly reactive. Parkland is dedicated to setting the standard of excellence for both public and academic healthcare systems, and is leading the industry transformation to prescriptive and proactive care. So talk to us about some of these SAP COVID co-innovations and creating value from the data.
Yeah, so there's a couple that I think are worthwhile to bring up. So one of them being the symptom tracker. So we use the chatbot feature inside of SAP Cloud to do symptom tracking that was available on our website. And that had to be something that was bilingual, both Spanish and English, and available to our population. We were successful there. And then based off the results of what the chatbot found, we may refer you to further testing, etc. There was also the need to gather, like I mentioned previously, social determinant information for these patients. So to dive into that one a little bit deeper, as we do this outreach to patients that are potentially at risk, you don't want them to have to leave their home if they have a food insecurity or a work concern. And so we were looking for that additional point of data when we calculated the risk score and did a piece of outreach. And then depending on the response, we would flow this back into our EMR system, and our social workers could reach out and take action for them. Another one that was really important was our ability to use a system to capture what would have previously been more manual data. In this case, it was what was available in stock from a PPE perspective, a bed perspective, and all these other critical components to the COVID crisis that we needed the command center to have access to. And we did that through Qualtrics. We put the survey, we made it available to the staff that were counting the stockpiles so that we could put it up onto the dashboard. And all these really helped form this response that we took. Then when you look forward at what we're trying to do today is leverage those decisions we made during the crisis and continue expanding upon them. So flu is now an issue in fall. And just like we did with COVID, we're doing something different in our flu response. We're providing the command center with information at a glance that shows how many flu vaccinations have occurred, where are we giving flu vaccinations, what does the spread look like in the community, how does the stockpile of vaccinations look, and this is going to allow them to better formulate a response to potentially both the pandemic and the annual flu. We're also looking at the next iteration of that, which would be just at a glance the hospital as a whole. So rather than being disease focused, expanding it to be capacity of the whole hospital, capacity of the care teams that are treating our patients, and all those other components that I talked about. And that really moves analytics into a core component of operations, whereas before, I think it was more retrospective. Not that we didn't want it there, but because of what's happened, it's taken more of a spotlight as its ability to help the organization move through this has been highlighted.
So talk to us about how Parkland is using the business technology platform and the ways you have benefited from its capabilities. So how has the business technology platform accelerated innovation and enabled Parkland to integrate, extend, and build intelligence at scale?
So, I mean, this goes back really to that architecture diagram when you look at all the components that we've enabled from BTP. So SAP HANA as a whole, storing our enterprise data, the modeling components inside of XSA and the HDI containers that allow us to essentially firewall off the various groups that are distributed and building data. You know, when you think about how it used to be, there was concern that if a external group outside of IT was to come in and make use of IT tools to build their analytics assets, they could potentially use up resources, have long-running queries, impact others negatively. And so utilizing XSA, HDI containers, and this kind of siloed footprint that still allows them to share, that concern goes away and allows IT to really focus on training individuals and enabling them.
So what's next for Parkland? You talked about this analytics first approach. What's your vision?
So there's a lot of things that we're doing. And I mean, it goes back to in 2014, we were looking at how do I get a report out today, to 2020, how do we enable chatbots and RPA and predictive. And I think what the future is a collection of more streaming data, better predictive components, looking into wearable data and how we can fully utilize that. And then taking all of those and really focusing on social determinants and community health needs through preventative medicine and all the ways that analytics can help with those goals.
Thank you, Clay, for sharing the story of all the amazing work you and the Parkland team are doing. You truly are transforming the healthcare industry, and it's a privilege for SAP to partner with Parkland.
Thank you, Sally.